Welcome to this guide of Phlexglobal's regulatory operations platform, PhlexRIM. As you can see, logging into PhlexRIM through your browser is all you need. And once you're logged in, what you're seeing presented to you is your customizable or personalizable dashboard. These can all be selected and used to help you navigate through the system. You also have all of the modules available to you here on the left, from general administration to document management and submission management, our planning and tracking capabilities, and our product management module, all of which I'll give you a brief tour of today. From an administration perspective, administrators are able to manage their own controlled vocabularies for values that would appear in various other parts of the system in drop-down menus that allow you to ensure that you're using consistent and accurate information everywhere that you need these vocabularies to be present. These are very important as we move into document management because metadata is often driven from those vocabularies. FlexDMS allows a user to have a 21 CFR compliant document management system that is used for assembling documents that will eventually show up in Flex Submission as they build an ECDD submission, for example. I have an example here already set up with this folder, which is really what we call a product folder. And that's because not only does it act like a folder, but it contains a number of those dictionary values that will be later used when producing a submission and ensuring that all of the proper folders are automatically created. So you can see here that I have substance information, as well as substance manufacturer, dosage form, excipients, indications, etc. Once I have that product created, I treat it just like any other folder, and I can upload my documents into it, or I can create new documents using my own templates right from within the system. So creating a document is as easy as giving it a title and saying what type of document it is. And here we'll say it's just a regulatory document. What's also important to note here is these 4 metadata fields that have tags next to them, because these are important when assembling clinical documents and where study tagging files are needed for the US and possibly for Canada. We'll automatically create that study tagging file using these tags on these documents. The render on publish checkmark indicates that this document will be converted to PDF automatically when I publish the document. So once I save the document, you can see that it's now listed here as demo document. It's a Word document, so I can tell that because of the blue icon. And then editing it is as simple as clicking on the document link. It'll download to my desktop, and then I would just upload a new version. There's also a number of options that allow you to have tighter control in regulatory document management that enforce things like checkout and check-in, as well as having an affirmed review and approval process where a document cannot be published until a second set of eyes has approved that document, all captured in electronic signatures and in the audit log. For our purposes, I will just publish this document, and you'll see that it's been queued for publishing, and it'll say rendering. In a pretty quick fashion, it will become published, and now because it's published, it's a document that I can use in a submission. There's a number of other time savers here in terms of uploading documents in batches, publishing batches of documents that are currently in draft, and even editing the metadata on multiple documents all at once. The end goal, though, is to have published documents ready to use in a submission. If I go into submission management and look at my submissions, this is my workbench where I'm working on all of my submissions for various countries and various products. Here's the example of a submission that I made from the product we just looked at. So if I click on that submission and open it, you're going to see that it's got the entire set of trees or the structure required for an ECDD submission to be submitted to the United States. Once it loads, you'll see that all the folders are there, and there will be some documents already assigned into those folders that I did earlier. This example in the cover letters is showing you that by the green plus sign, that's indicating that this will be a new document in the submission. Flex Submission will automatically determine the lifecycle status of any individual document, whether it's new or a newer version replacing a prior submitted document in an earlier version. So adding documents to this is as simple as opening my documents browser and then dragging and dropping it to the appropriate folder and saving my submission. And you'll see here that by doing that, this document will also show up as new because it's the first time this document's ever been used in any submission for this application. I have some other time savers in here as well. My tree tools will allow me to do things such as open and close all of the folders or some of the folders. So if I wanted to just close empty folders to compress things a bit, I can do that. And I'm automatically seeing a little bit cleaner view. I can also open and close folders by module. In tree and DMS tools, one of the things that's very useful is Vera's auto-compile. Auto-compile allows a user to predetermine the placement of a document in a submission by populating a metadata attribute for that document's folder location. When using auto-compile, we'll automatically use that information and place the document in the correct folder. I also have compliance tools that allow me to do things such as check if I have all my hyperlinks in the document showing as valid. I don't have any errors, so I don't have any message here. I can also check broader ECTD compliance, and again, no problem. Once I have my submission in a state where I believe it's ready to be published, best practice approach is to do what we call a test publish. In doing a test publish, it allows me to determine if everything is in place to where I would like it to be, and I'll fill out my envelope information, which will be saved from publish to publish. But basically what's going to happen is we're going to generate the full ECTD output in a draft state so that we can go through and double check how we're doing with the output. Now I did one earlier that I'd like to show you that I have also the ability to validate that submission immediately online using the eValidator. Once I've run that process, I can see the results here. And in this example, I have some error messages. I have 2 high-level errors, 3 medium and 1 low. I can also view this report online or download it. This is why we have a test publish capability, because this gives me the opportunity to resolve those issues. By simply going back into my submissions, I can make whatever adjustments I need for that publishing, and then finish the submission and do a final publish. Doing a final publish will do 2 things. It will create the output that I need for my submission. You can see my test publish is still running. But the other thing it will do is it will set up my submission for the next sequence. As you probably know, ECTD submissions are rather transactional, and each transaction is referred to as a sequence. One builds on the last or all the prior sequences. So it's important to understand that lifecycle management is a key component of any ECTD capability. Once I have my published output, it would be here in my published submissions folder. And this is where I would be able to, again, validate the output if I wanted to, or download this submission as a zip file, which I could then upload through whatever gateway mechanism or in other places burn onto a DVD, so I have it ready to transmit to the health authority. Staying on top of submissions really is a matter of planning and tracking. In this area, another administrative highlight is the fact that you can define any type of activity that you might do from a regulatory perspective, as well as determine and define the business process lifecycle of that in terms of what stages that type of activity would go through. In addition to that, you can also define by activity type additional data capture requirements that you may want to have. This is all highly configurable, and as you move through that business process lifecycle, there are even further capabilities in terms of what we call workflows, which are basically automations that can execute and do things for you as you enter each stage of that lifecycle. Now, to show you what this looks like from an activity tracking perspective, you'll see it looks like a list of information, but what's most important here is looking at the status column, because this is what's showing me where am I at in that business process lifecycle. And simply by clicking on that, I can see which stage we're at and be able to advance this into the next stage. For example, I'll move from planned to ongoing. If I had workflows configured at the ongoing stage, they would execute now. But you can see there's also the ability to capture additional data if you needed to. In this example, we just have the lifecycle options. What's more important here is the ability to visualize this information as you look at your entire submissions portfolio. What are all the regulatory activities you have going on at any one point in time? You can look at this in terms of a calendar view, for example. And here are all my activities that are now being visualized in this calendar. And I can apply filters and save these as personal or group reports as well. There's a number of standard reports that come with the platform. I can, in addition to seeing it as a calendar, I can see it as a plan in terms of Gantt chart visualization. Or I can look at it by countries and see which countries have the most activity going on in them. This really serves as a centralized hub of planning activities, because not only am I looking at the status, but I can also link my activities back to my particular set of documents, as well as to a specific submission sequence that relates to all of this work. Ultimately, if we're successful, as we all hope we are, and have a product registered, we use our product management platform to keep track of that information for tracking purposes in addition to eventual reporting requirements. Today's version being XEVMPD and tomorrow supporting IDMP. But the information is relatively similar, although IDMP is far more complex. And the information that we're tracking at this point is the end result of producing those submission sequences with the goal of getting a product approved. So I have now marketing authorization information. I have information about my pharmaceutical product and its route of administration, for example, some of the ingredients, whether or not a medical device is involved, as well as indication information, and even relating other documents that are important to keep track of from a product management perspective. This allows our customers to have a full suite of an integrated platform, from documents to submissions to registrations, and supporting all of the regulatory requirements related to that, such as ECTD, XEVMPD, and IDMP.